But what I'm really trying to understand is if a person's walking through an airport wearing a mask and you knew that they were not sick.
I have a general sense that in the last 5 years since the pandemic and since we've seen a shift in culture around medical access and insurance and people getting proper care and political things and turmoil, I think most mental health providers and epi research would show this, Peter, that we've seen a significant increase in mental health awareness, a significant increase in people coming to therapy for the first time, a significant increase in people staying in therapy longer and longer. And we've seen a significant spike in general anxiety since 2020, almost a twofold spike in most research studies. So all of that combined with a general sense of not being able to afford healthcare or frustration with your healthcare providers, I just feel like we're hitting this unfortunate, perfect, terrible storm of people being more vigilant about their medical and mental health needs in good ways, trying to be advocates and trying to seek services. But also I think we are, as at least in the United States, there's just a general sense of increased anxiety and stress on all of us. And as you know, stress and anxiety turns somatic, turns biologic. But I think those three big areas of social media, wearables, and access to healthcare are big players. But COVID got all of us to think about this stuff. And I was joking with some of your team before I came in here, but even on the flight over here, someone was coughing in the row behind me, and I thought, crap, what am I going to come home with? 2019, never would have thought that, honestly. Today, when your kid's sick, you're thinking, how many days of work am I going to miss? So somewhere in the last few years, and I don't battle health anxiety yet.
But what I'm really trying to understand is if a person's walking through an airport wearing a mask and you knew that they were not sick, so they were doing it for fear of getting sick.
Sure.
Is there any reason to say that person's not psychologically functioning on all cylinders at the moment?
I think if that mask is being used as a cover to avoid social interactions, as a way to get out of other events, to make sure you're not working in a certain part of the restaurant, possibly, when you really don't need to do so. If you're just wearing the mask because you're just a little bit extra cautious and don't want to get sick, again, if we don't care about it and you stay employed, let's say it's an employee or you're walking through the airport, I don't think there's anything pathological about that.
What about driving with a mask on?
That
you're the only
blows
person
my
in the
mind.
car, and they're driving with a mask.
Now, if there's a rental car, you might go, gosh, like I could see, what if they thought, again, I think that's pathological to me, and I think we can probably say both are. But if, to your point, if someone doesn't have an illness and they're not trying to spread it, and we don't believe they have any state of immunocompromised status, and they're wearing a mask, it seems off.
And so should the majority of people who are not wearing masks look at that person with empathy as opposed to disdain, which is probably how most people look at that individual?